recording. So we are recording now, and we're going to get started with the webinar. So again, my name is Jeff Weiscarver. I'm president of DDME, and DDME with Whitmix are presenting these free webinars every other week. I think we're going to start doing them once a month over the summer. And it's a courtesy to our customers and potential customers because the educational aspect of treating patients with Bruxism and sleep apnea is fairly high, and we like to help our customers and potential customers with that. And so we do offer these frequently. Okay. Today's webinar is going to be selling from the chair. And so what that means, if you haven't started yet, if you haven't started testing your patients or treating patients with sleep apnea, then you may not know that as you talk to patients, there may be some reluctance on the patient's part in order to proceed with testing and being treated for snoring, sleep apnea, or bruxism. And as a result of that reluctance, we at DDME over time have learned essentially kind of how do you talk to patients and how do you prepare them to maximize the opportunity and increase the chances that your patient would be willing to proceed. So the idea here is you as a dentist selling this new or potentially new service to your patients. So that's essentially the concept here. Uh, on that topic, we're going to talk about developing a message, and not every message is the same. So there's certainly a range of topics to solidify and communicate with your staff, but there does need to be a message, and there does need to be a conscious decision to say this is the service that we're going to provide. This is why you would do it as a patient, and then there's all the benefits of being tested and treated. That kind of takes us to the next bullet there: snoring, apnea, bruxism, and the health benefits of managing those issues from the dental chair. There's some tremendous benefits there all around. There's benefits for the dentist. It's a great financial opportunity if it's implemented in a conscientious fashion. It's a great opportunity for your patient, and the health benefits of being treated earlier than they might ordinarily be treated if they waited and went down the medical path. I can't tell you the benefit that is. So there really is a number of good reasons why you do want to start, if you haven't already started, helping your patients on these areas. So that's great, and that's everybody says that's great that that's the case. But at the end of the day, you as a dentist, you have a business to run, and so we have to pay careful attention to balance. Okay, the great opportunity with, okay, my practice needs to stay successful, and how do I do that incorporating this new practice? So with that in mind, we're going to have a little bit of a discussion on payer, and you need to know, and when I say payer, I mean medical insurance payer, because most of what we're going to talk about falls under medical insurance. So you do need to have a concept of the mix of payers in your area, and that will have a big decision on whether or not you decide to bill medical insurance at all. And if you do, then you need to get to know your payer. If you're not, then you need to prepare your patient for the out-of-pocket expense. And I have to say that the way that medical insurance is going, out-of-pocket expenses are going higher and higher. So a lot of times it's fee-for-service anyway. And that's the way, the patients are having to face that even when they go visit their physician. There's just the deductibles are going way up. And then finally, there needs to be a financial strategy. So once you have a concept of your payer mix and you've made the strategic decision whether to bill medical or be a fee-for-service or some combination of that, then you need to set a strategy in motion, and then there will be some activity and some training and procedures that will make sure that your strategy is effective. So we'll talk a little bit about that. And then finally, I am going to talk just 1 or 2 minutes on what we at Whitmix and DDME sell, and it won't be more than 5 minutes, okay? All right, so let's get started. Asserting your dental authority. All right, so this is actually one of my favorite topics because as dentists, we do realize that you have to sell your service. You know, it's a little bit different than physicians. So the example that I like to use is if a patient is at their cardiologist because they have chest pain, the cardiologist doesn't need to sell anything. He just needs to share his advice or her advice. That's it. You as dentists don't have that luxury, so you have to sell what you're going to do. However, when you're talking about sleep apnea, that is a medical issue, and it has tremendous health consequences. And to me, that gives you legitimacy in being a little more assertive when you sell. And one of the stories that I like to tell on my own personal experience is when I was in high school, I lost 26, my lower right tooth. Took an elbow to the chin and lost a tooth. And about 2 years ago, I was at my dentist, and he said, "Oh, you know, I just learned about these mini implants. You know, they're 2.5 millimeter, and my tooth was very small, so it would require a mini implant." And he goes, "Listen, I could put an implant in there and get that taken care of." And I said, "Yeah, doctor, that'd be great, but where would I put my straw?" And I was just telling a joke and trying to be funny, and the dentist gave up. And, you know, when you're talking about a $1,500 or $2,000 procedure, and he gave up just because I wanted to tell a joke, what I learned from that is how sensitive you as dentists are at selling and how reluctant you are to push your patients because, you know, there's a reluctance to be uh, negative you know, have a negative impact on what your patients. However, we're talking about a medical condition. So I think that, you know, we're not selling whitening, we're selling health benefits, and they're dramatic health benefits. So, you know, the idea here on this slide is, you know, if you manage this, there's consequences to hypertension, congestive heart failure, obesity, and if you manage it, all those areas can be improved. It's very, very difficult to treat high blood pressure or any of these issues if you have sleep apnea. And as a dentist, if you start the ball rolling on therapy, the patients can manage those other conditions. So just keep in the back of your mind when you're talking about a patient and you know, they fit the category, maybe they're a little obese, they might have a little bit of blood pressure issue or, you know, early stages of diabetes or what have you. And you say, listen, you know, patient, I've started testing my patients for snoring and sleep apnea, what have you, and I think there might be some benefit for us doing a test on you. And the patient says, nah, I'm not interested. You know, take it one step further. Say, listen, you know, this really is a benefit. It's very inexpensive, and we do a good job of guiding you down this path, and I really would encourage you to think about it. You know, maybe after they say no, you know, offer one more or another set of reasons and then let it go, as opposed to like what that dentist did with me when he offered an implant and I cracked a joke and he gave up. You know, don't. I guess what I'm saying is don't give up so easily. Um, Now, as we're talking about this, and, you know, and selling from the chair and convincing our patients that this is a good thing to do, this is a process. And when I say this, treating patients with snoring, bruxism, and sleep apnea, it's a process. It's not an event. So in the case where you introduce the concept to the patient said no, and then you said, you know, really, you should think about it. It's a good idea, and it's a great way to get started on some of these other health benefits, and they still say no. At the end of that conversation, say, well, just think about it, and maybe we'll bring it up next time you're in my office. You know, something along those lines. Um, and one of the things that can work on a subconscious level is visual cues. And so when you're talking to your patients and they come in and you or the patient comes in, say, listen, we have a new questionnaire. I know that you filled out the medical questionnaire before, but we have a new one. Would you mind filling this one out? And make sure that that questionnaire has some sleep questions on it. You know, and maybe have a poster in your office or what have you. Um, and and then when you do that, that kind of sets the thought and process, and maybe not at a profound level, but at a subconscious level. So as the patient kind of gets used to the idea at a subconscious level that this is the service that you're going to provide, when you actually introduce the topic, you know, right in front of them, and you're very direct with them, it's not going to be such a odd thing for them uh, to hear from you. Okay. And some of the ways you can kind of initiate the conversation is snoring is always a good topic. And obviously you have to be sensitive about that. Um, and by that I mean you don't want to say, hey, do you snore? Because if you do, we can help you. But you might want to say something like, has anybody ever mentioned that you snore? Or you might even say, even indirectly, do you know anybody, or does anybody in your family or friends, do you know that they snore? Because this is a new service that we're providing. And they might say, well, I don't know about anybody in my family, but I know I snore. My spouse complains about it all the time. So those are the types of things that you can get the conversation started in a very non-threatening way. And if you get a favorable response, then take them down the path. Get them started. Um, but I think at the end of the day, the most important thing is to bring this up in a non-threatening manner. And there's some things that occur that I think are a mistake. Because what happens in dentistry, like as a dentist, if you go to a seminar, a lot of times the messaging is very foreboding. For example, sleep apnea is life-threatening and can kill you, and there's a very foreboding messaging that goes on there, and that might be good to convince the dentist to get started as a new service. But when you talk to patients, if you were to say, listen, I treat sleep apnea and sleep apnea is life-threatening, that's a turnoff for your patient. Okay, so if a messaging such as that worked on you, it may not be the best messaging for your patients. Okay. Um, when you're bringing up the topic, there's a variety of the topic of treating your patients. There's a variety of ways that you can bring this up, and here's a sample questionnaire that has a number of sleep apnea related questions on it. The top part of this, there's the Epworth Sleepiness Scale. And, I'll be honest with you, the Epworth isn't really all that great of a questionnaire because it's so open to interpretation. The answers vary widely. Um, but payers, medical insurance payers, really like the questionnaire for some reason. So you should always include the Epworth, even though clinically it might not be a great questionnaire. From the getting reimbursement from medical insurance, it's a critical questionnaire. And again, like here at the bottom of this, there's the stop bang, and that's just an acronym for the items you see there for snoring, tiredness, pauses in breathing, and so on and so forth. So as you're going through the questions with your patient and they're still not convinced, but you're asking them the questions, the longer you have the conversation with the patient on this topic, the more likely they are to get buy-in and become willing. Okay. And then, just as a side note, when you're filling out this questionnaire and when the patient's filling out their part of the questionnaires, this is all documentation for billing medical insurance. And we talk about, not on this particular webinar, but on other webinars, billing medical insurance. And this is the type of documentation that payers are going to require. Visual cues. So I mentioned that a little bit earlier. Visual cues are important because it lets the patient know that you're for real on this particular topic. And I'll elaborate a little bit by that. And patients may not necessarily be expecting you to bring this topic up. So when you ask them about snoring, it kind of fits in a little bit. But certainly sleep apnea is a bigger stretch for patients. So if you start with sleep apnea, it's a pretty big stretch on a lot of patients' expectation of what a dentist does. It's the example I use is, some dentists are getting into Botox. And not that that's a bad thing, but sometimes if you say, oh, listen, I offer Botox, patients are saying, what? Aren't you a dentist? It's that kind of a thing. And same thing with sleep apnea. So they may not equate getting treated for sleep apnea with dentistry. So you have to be careful about how you introduce the topic. And some of these visual cues will kind of allow them to associate some of the airway issues and sleep apnea that we talk about with regards to sleep apnea and dentists being able to help them with that particular problem. Another topic that I brought up, or another thing that we need to think about and have a conversation, is balancing the message. And I've talked about this a little bit. And by balancing the message, you have to be careful about being too frivolous about it. Hey, we treat snoring, and if your spouse is irritated from your snoring, hey, let's take care of your snoring. That's kind of frivolous. And then the other end of the spectrum is sleep apnea can kill you. Okay, so there's got to be a balance between those two, but both should be included. And an example is, as I mentioned earlier, just bring up snoring as something that you can help patients with, and that may lead to other topics such as sleep apnea and so on and so forth. And then in that, you may say, listen, there's some really nice health benefits that you can experience if we manage this issue well. So you might want to think about the health benefits that we can enjoy if we tackle this. Um, Another topic that's kind of a little bit of a divergence from what I've talked about so far today is broken, chipped, or worn teeth. And if you've listened to any of my other webinars or you know me, you know that I'm always talking about the relationship between bruxism, damaged teeth, and an airway problem. And so that might be an angle. So if you're talking to your patient, they have some pretty significant tooth damage, that might be your entrance into this topic. Say, listen, I noticed that your posterior teeth are worn. That's a sign that of something that we can help you with. And there's a simple test that we can do to see if we can identify the reason why you're wearing down your teeth. That might be the way that you get started. So think about that. Think about that perspective. And then finally, this is more for the hygienist than anybody. People falling asleep in the dental chair. Okay, so a lot of times, I have to be sensitive about this. I don't want to be kind of step on anybody's toes or rain on anybody's parade. But a lot of time, hygienists will think, "Oh, my patient's so relaxed around me, and I do such a good job that they're relaxed enough to fall asleep in their chair while they're waiting for me to get started." Okay, that is not normal under any circumstances, and I don't care how much the patient appreciates you. Falling asleep in a dental chair is not normal. It doesn't mean you have sleep apnea, but it's not a normal thing to do. And when that happens, that might be the thing that you use to start the conversation. Say, listen, I can't help but notice you fell asleep while we were waiting to get started. Did you sleep okay? How's your sleep? Because it's a little bit unusual to fall asleep while you're waiting for a dentist. Some people are a little bit stressed out about dentistry or getting dentistry done. So, that might be a way to start the conversation. But the idea here is have a balanced way, non-threatening way to initiate the conversation with your patient. Okay. I'm going to take a pause here and just want to make sure I'm not missing any questions. Okay, it looks like we're good there. So, okay. So, scripts. Script sounds, I hesitate to use the word scripts because sometimes it can come off as contrived when you're talking to your patients. Um, but I always recommend that once you establish your message, stay pretty tight to it, and even practice, role play. Because once you get started and once you have kind of a way in which you can have success, more common have success and more common people saying, your patients saying no. Make sure that those messages where you're successful, you use those over and over again. Okay, so if at first you don't have, if at first your message, the first time you try your message, the first three patients says, no, I'm not interested, try a little bit different, try changing it a little bit. And then when you get a yes, remember what you said when that patient said yes, and explore that as a way, as your script, quote unquote. Okay, so not necessarily that you write down a script and you read from it, but just get the idea of what's successful. And again, my guidance in that area is be non-threatening and balanced. Okay, and then try 2 times. When the patient says no, uh, come up with a couple more good reasons to do the test, and if they say no a second time, then say, okay, just give it some thought and let me know next time we get your teeth cleaning. Maybe we'll see what you think about it then. Okay. And then as you're talking to your patient, kind of get a sense of where they're at, where their willingness is. Look at the body language, listen to the tone of how they say no. And if they're really adverse to this, um, just kind of make a mental note of that, because a lot of times when people are really adverse to the idea, what that actually means is they know they have the problem and they're afraid of it. Okay, that's what it means most of the time when somebody says not no, but heck no, I would never get a sleep study done. And if you sense that reaction, say, okay, that's fine, but just out of curiosity, what is it about the sleep test that's a bummer for you? And listen to what they say, because probably what they're not going to tell you, but what you might be able to extrapolate from their answer, is that they kind of know that this is an issue. And it's, the thing that I use to equate is like, if you have bad credit, do you really want to know your credit score? Okay. Well, yeah, if you want to improve your credit, you need to know where your starting point is. But sometimes it's hard to face that bad credit score. And it's the same type of thing with sleep apnea. If somebody in their mind knows that they have it, they just don't want to face it. Okay, that's usually the issue. And when you sense that that's the case, be as gentle as possible. Say, listen, I know there's a lot of hesitation to do this, and we can stop the process at any point, but it might be a good idea just to get a test in to see where we're at. Just kind of have a gentle nature about pushing them a little bit, because again, at the end of the day, if you talk them into it and they do the test and you can help them, the health benefits are I just can't emphasize that enough, not to mention all the other benefits I mentioned earlier. Okay, so you have successfully introduced the topic and the patient says, yeah, let's go ahead and schedule a test. So there is a test involved. And, this is where I'm going to kind of talk about our monitor in the course of telling you what's involved. And I know that a lot of you on the call, I recognize the names, and, this part of the conversation might be a little bit redundant. So just bear with me, but I'll go quickly. So there is a test. The unit that we use is very good for two broad reasons. It's an excellent clinical monitor. It does a great job of giving us critical information, and it's easy to use. Okay, so that's a great combination: easy to use and excellent. As far as the clinical data. So there's once you've identified the patient, you've done a questionnaire, you've done an interview with them, you've documented the reason for the test, then you schedule the test, and these are the steps that the patient goes through in order, when they're at home with the monitor, in order to collect the data. Okay. Once they've collected the data, the next part of the process is they bring the unit back, and there is a download. And on that download, I'm going to spend just a second here talking about what's involved there. We're not going to go over all those squiggly lines and what's happening here. And I know a lot of you are probably very familiar with what you're looking at, and some of you that are new and just thinking about getting started, that the screen makes no sense. The point of showing you the screen is this is what's being collected in the background. A lot of dentists do this. They never necessarily look at this data. That's why they subscribe to our services, because we manage this part for them. But suffice to know that when we say the monitor is a good monitor, this is why it's a good monitor. The data that it collects is very high quality, and it's the same exact data they use in sleep labs. Okay? So the reason that that's important to know is because in dentistry, there's a number of home sleep testing monitors available. And in many of those technologies, they're brilliant, they're unique, a lot of thought, a lot of smart people develop them, but it's not what they use in sleep labs. Not that that's good or bad, but sleep labs have a certain way of doing things, and you can't measure necessarily from the forehead, for example, a lot of times what sleep labs are looking for. Or there's other devices that measure from the finger. That's just not technology generally used in big sleep labs, okay? The device we use uses the same technology they do use. So when, as we, for those of you that haven't started and are just thinking about this, know that you will need to interact with the sleep lab, There's no way around it, and we will help you with that if that's the if you want, if we're lucky enough to get you as a customer. We will definitely help you interact with the sleep lab. It's not the easiest thing in the world to achieve, but at the end of the day, the sleep labs like this data. Okay. Um, the download that gets done, I'm just going to show you this screen here. It looks a little bit imposing, but suffice to say, everything you'll need to know about the airways on this screen. And you know, with myself or when Shannon does your training, if we haven't trained you already, I see that some of the folks on the call have already been trained. Um, you know, I'm sure most of them would agree that the first time they looked at this screen, they says, wow, look at all that. And then after a few minutes going through it, it's not that big a deal. Okay. This is a report, and the device that we have is software, and the software that we use has a lot of different kinds of reports. This is one of them. Okay, I think there's about 20 reports. This is what I like this report because it's very small, short, simple, but it has everything you need to know to triage your patient. Very, very nice report. It gives you the AHI, which is a basic respiratory parameter, the apneas and the hypopneas. It gives you the ODI, the oxygen desaturations, very popular in dentistry. And then it gives us how much you're snoring and how loud you're snoring. Okay, and then above that you'll see kind of this chart of numbers. Those are the parafunctional EMG activity. And the thing one of the things I like about our monitor is that it has this integrated EMG amp along with all the respiratory parameters. So we record the clenching and the grinding on the same time axis as the respiratory. So it's really easy to see if like somebody has an apnea and then they clench at the end of the apnea and they do that over and over again, you know, let's focus on the airway. And then once the airway is managed, let's see if their bruxism persists, because a lot of times it doesn't. So if you manage the airway, the bruxism reduces or even goes away in some cases. Okay, so that's the nice thing about the report, is it gives you a sense of what's happening with the patient. And I'll say one thing about sleep in general and this type of report specifically. Sleep in general, obviously we all know that you basically are unconscious of what's happening, okay? And one of the things I find, I don't want to say it's annoying, but I have to say I'm surprised, is how many people say, well, how did you sleep? Well, actually, how would a person know? I mean, if you have a bed partner, maybe they can identify some aspects of sleep. But really, I mean, you know, if a dentist puts in an appliance, for example, and then a couple of weeks later they say, well, how you doing? And the patient might feel better during the day. You know, maybe they can certainly talk about that. But they certainly don't know how they're doing when they sleep. So when you have this type of report, you can ask your patient how they're doing wearing their appliance, and then do another test and then generate this report with them wearing the appliance. And you can say, oh yeah, your AHI started at 13, and when you wear your appliance, the AHI is 3. And you're feeling better during the day, you know, I think this has been very successful. You know, it kind of helps reinforce things. So I just wanted to mention that real quick. Another thing that we've done and is when we first, you know, especially when Shannon and I first started introducing the concept of the relationship between the airway and bruxism, I would say most dentists, maybe even the vast majority of dentists that we introduced the concept to, they would say, okay, well, if the airway is triggering the clenching and grinding, what am I supposed to do? And we'll say, make a sleep appliance. And they say, well, that's a non-starter for me because I just don't do that. I heard, and then there's any number of reasons why a dentist would not want to treat sleep apnea. And so that was not a really good answer, you know, sleep apnea appliance, an oral appliance. So what we ended up doing at DDME is developing a product called the BRX Pro. And the BRX Pro is a bruxism guard. It's a dual arch transitional, and it's adjustable guard. And so it has a couple of features that are unique. One is that it's partial arch. That's not necessarily unique. But two, um, the reason that it's partial arch is we don't want the posterior teeth coming into contact with each other. Obviously, that's the whole concept of the NTI. But then also, the posterior teeth can come into contact with acrylic. And the reason that we don't want posterior tooth contact is because the trigeminal nerve is thought to be the culprit in giving the masseter so much power. Okay, and the masseter is a very strong muscle, and when the trigeminal nerve innervates, it appears in the research that that's what gives the masseter so much strength. If you prevent the trigeminal nerve innervation, then that greatly reduces the energy expenditure. Okay, so that's the idea of the partial arch. It's adjustable, so patients with the variety of class bites, you can set a healthy mandibular position. So for those of you that are familiar with sleep apnea appliances, you know that you kind of start in some percent protrusive and then you slowly titrate the mandible out. That's not what we're doing here. What we're doing with the BRX Pro is, because it's a bruxism guard, we're just wanting to prevent the mandible from going back into the airway. We're not really, the purpose of the BRX Pro is not to treat sleep apnea. It's to stabilize the airway. Okay? And then obviously, if you have a dual arch guard, you're protecting the teeth. Okay, and at the end of the day, as a dentist, that's one of your primary jobs, is to make sure that the patient's teeth get protected. So that was the purpose of the BRX Pro. And you know, like I mentioned, I'm not going to spend a lot of time talking about that. So I'm going to wrap up here in just a little bit, but I did want to mention a couple of things. One is uh, ongoing training. A lot of times dentists will come to me and say, who would you recommend, or what classes do you like? So I feel that I want to bring that up at each of my webinars. And one of the webinars, or one of the seminars that I've really enjoyed, that I've attended myself more than once, is the Dawson Academy. Dr. Wilkerson gives kind of an integrated health, dental, sleep medicine seminar, and I find it's a great balance of dentistry and patient health, and I like the approach. And so there's a much wider view of a patient's health than just focusing in on their teeth. That's kind of the component that I liked about this. And part of any program that has to do with improving a patient's health must include some type of sleep, because if you're not sleeping well, almost everything is for naught. I mean, there's just tremendous headwind on, just for example, treating high blood pressure. It's nearly impossible to treat high blood pressure on somebody that has moderate to severe untreated sleep apnea. You just really can't do it. So as a dentist, because you see patients so often, you have that opportunity to intervene much sooner than the patient would if they were waiting for their physician to bring it up, or if the patient brings it up to the physician. I mean, honestly, it's extraordinarily rare for a patient to say, hey, geez, listen, doc, I think I have apnea. It happens, but it usually happens so far down the sleep apnea path that the patient's usually very sick, and the only reason they're bringing it up is because they can't stay awake during the day, or they have uncontrolled health issues that they think might be related to sleep apnea, and then they bring it up. As a dentist, if you identify the problem much earlier in the disease cycle, they don't have to go through all that grief of getting very sick and then bringing it up to their physician. So that's one of the basic opportunities that I like about dentists doing this, and that's a key component in this course. Another good course is Dr. Rouse. Jeffrey Rouse does a good, he offers a very enjoyable program. This one happens to be in Napa in July. I'm going to see if I can make that one. And if you're interested, the phone number is there. Oh, I did forget to mention, I'm going to back up a slide. If you're interested in the Dawson Academy with Dr. Wilkerson, there's the 800 number there. Feel free to call that number. It's 800-952-2178. And on the Dr. Rouse, Jeffrey Rouse, it's 210-828-3334. And say you'd like to attend the conference in Napa, and they'll know exactly what you're talking about and sign you up. Okay, So that is generally what I wanted to cover today, just to kind of wrap things up. First and foremost, it's Friday the 13th and you're at a webinar, so I don't know what that means, but I wanted to thank you for coming today, honestly. Um, Also, I wanted to offer, if you're not already working with us and you found this interesting, I would be very happy to schedule a 30-minute webinar with you, kind of get a feel for where you're at, and we can have a conversation about how or if you'd like to proceed. I can send you a quote on the monitor that we talked about. And then I did want to kind of just remind you about the 1 hour CE. You can, my email's there, jeff@ddmeonline.com. Just shoot me an email. My cell phone number is there as well. Now today I'm going to be at the CDA like I mentioned at the beginning, so it might be a little tough for me to answer my phone today, but leave me a message, say, hey Jeff, this is Dr. So-and-so and I'd like to take that test, and give me your email address and I'll be sure to shoot that test out to you, okay? Um, so at this point, I'm going to get quiet and I'm going to let the meeting go for a little bit. So if anybody had any questions or comments, now's the time to ask them or make your comment, and and then we'll end the session here in about 5 minutes. Okay, let's see. Where can we get a copy of the questionnaire? That is, who is asking that? That looks like Dr. Cho, Michael Cho. Yeah, just shoot me an email, Jeff@ddmeonline, and say, listen, I'd like to get a copy of the questionnaire, and we have a couple samples. Enjoy the CDA. Oh, I'll try to. Trade shows are a lot of fun. So thank you, Dr. Spence. That was nice. Yeah, I'll get you out the questionnaire. If anybody else wants that questionnaire, actually, what I might be able to do, Dr. Cho, is I will put a sample of the questionnaire on the download, and you can, let me see if I have it here. And then you can download it now or just shoot me the email like we talked. But I will upload it to the download box. You can see there's a place to download your download file. So it's called Handouts, and I'll put it in the handout section. Let's see. Okay. Any other questions? Okay, looks like that's good. Okay, so I'm going to go ahead and upload that questionnaire for Dr. Cho, and then we'll call it a day. Again, I appreciate you guys coming, especially on a Friday afternoon or Friday morning, depending on where you are. And have a great weekend. So I'm going to stop the recording, but Dr. Cho, give me a second. I'll upload that file. Okay, thanks. Bye bye.